we can describe external structure of the heart. It is anterior surface or fascia sternocastalis. Why? Because it's attached to sternum and ribs. Posterior surface attached to diaphragm, and more better inferior surface. It's attached to diaphragm and has name fascia diaphragmatica. And two lateral surfaces here and here, they attach to lungs. That is, name of them are pulmonalis, fascia pulmonalis. Fascia sternocastalis in front, inferiorly fascia diaphragmatica, and laterally fascia pulmonalis. Now, grooves between atriums and ventricles. On inferior surface, we can see groove sulcus coronarius, coronary groove, sulcus coronarius cordis. And between ventricles, we can see two grooves. On posterior surface, sulcus interventricularis posterior, and anteriorly it is sulcus interventricularis anterior. These two grooves join together laterally from the apex. Look here, it is apex of the heart, and laterally of apex here it is. Place where two grooves join together. And name of this, notch in caesura apicis cordis. Notch of the apex of the head. In caesura apicis cordis. Next, I think you know that heart has how many chambers?
Four chambers.
Two atriums, right and left atriums, and right and left ventricles. We start from right atrium. Right atrium receive blood from superior and inferior vena cava. It is opening of superior vena cava, and it is opening of inferior vena cava. And also blood from heart inflow into right atrium through sinus coronarius cordis, coronary sinus, that is veins of the heart formed, joined together, formed sinus, and this sinus open into right atrium. Look here. It is opening of coronary sinus. It is sinus coronarius cordis. Three veins inflow into right atrium: superior vena cava, inferior vena cava, and coronary sinus, sinus coronarius cordis. Next, between right atrium and left atrium, we can see septum. Septum interatriale, between atrium, septum interatriale. This septum has fossa. It is fossa ovalis. Fossa ovalis is on the place where in time of development of fetus present foramen, foramen ovale. Through this foramen, blood from inferior vena cava, look here, it is inferior vena cava, and blood from inferior vena cava go in from right atrium into left atrium, and from left atrium into our. We will speak a lot about circulation of fetus after 3 weeks. That is why it's only necessary to know fossa ovalis in place where in fetus present foramen ovale. Clear? And body of this fossa ovalis, it is limbus, limbus fossa ovalis. It is body of oval fossa. Next, you can see that surface of atrium is smooth, but in the region of auricula, it is additional chamber of right atrium, auricula dextrum, small ear, auricula, auricula dextrum. It is present muscles, musculi pectinati. It is sharp surface of right atrium in the region of musculi pectinati, and border between smooth surface of atrium and sharp surface in the region of musculus pectinati has name crista terminalis. Crista terminalis. And on the surface, here it is, look here, that is right atrium, here it is superior vena cava, and on the surface of atrium, here it is groove, sulcus terminalis. In the region of this groove, we have a node of conductive system of the heart, that is cedar atrial node, nodus sine atrialis, or kiss flex node, SA node, nodus sine atrialis. It is pacemaker of the heart, in the region of sulcus terminalis under the epicardium. Next, between right atrium and right ventricle, we have valve. Who know what is the name of this valve? Tricuspid valve. Tricuspid. It has three cuspids: anterior cuspis, posterior, and septal. Where they are here. Here it is cuspis posterior. Here it is cuspis septalis, and here it is only part of cuspis anterior. Anterior, septal, and posterior. Each cusp, that is two layers, double layer of endocardium, and to the border of cusp attach chordae tendineae. You can see this chordae. Here it is, chordae tendineae, and this chordae start from papillary muscles. In right atrium, we have, in most cases, three papillary muscles: anterior, posterior, and septal. That is posterior, papillary musculus papillaris posterior. Here it is septal, musculus papillaris septalis, and in front should be anterior muscle, only part of it I can see here. Here it is musculus papillaris anterior. And all another sharp surface of ventricle has name trabecula cardia, and only in place where ventricle continue into pulmonary trunk, you can see here, that is beginning of pulmonary trunk, you can see that surface of ventricle is also smooth like in atriums, and this smooth surface of ventricle in place where from ventricle start pulmonary trunk has the conus arteriosus. Here it is conus arteriosus. It is smooth. In left ventricle, the same, we have conus arteriosus, where left ventricle continue into what? No. Aorta. From right ventricle start pulmonary trunk, pulmonary artery, pulmonary trunk, and pulmonary trunk divides into two pulmonary arteries. And from left ventricle start aorta, and beginning of aorta it also has name conus arteriosus. Next. In the beginning of pulmonary trunk, it has valve, semilunar valve, valva semilunaris, which has three valvula. Here it is valvula semilunaris anterior, valvula semilunaris dextrum, and valvula semilunaris sinistrum. That is correct position of this valve. It consists of three valvula, and each of these valvula in middle part has node, nodulus valvula semilunaris. It's help to closed opening of pulmonary trunk in time of diastole. Do you know that heart has two stages of systole and diastole? Well, systole, that is contraction of heart, diastole, that is relaxation, yes? And in time of relaxation of ventricles, blood from pulmonary trunk is under the pressure, try to go into the ventricle, and this valvula semilunaris, it's closed this opening and stop passage of blood from pulmonary trunk into the ventricle. Is it clear? Now, compare wall of right ventricle. Here it is something near 5 millimeters, and a wall in left ventricle. It has 1.5 to 2 centimeters. Why it's so?
Because it have to
Pressure of the
blood in whole body.
Yes, 2 cycles in the blood circulation: small cycle and large. Small cycle, it's pass only through lungs, and right ventricle pump blood only through lungs. That is small cycle. A large cycle from all human body, that is from left ventricle and go into aorta. That is why we need a higher pressure of blood, and that is why wall of left ventricle is too larger, too thicker than wall of right ventricle. And heat is bicuspid or mitral valve, valva mitralis or valva bicuspidalis. Bicuspid valve consists of two cuspids. Cuspis anterior, heat is cuspis anterior, and heat is cuspis posterior. And two papillary muscles, anterior and posterior. And also we can see chordae tendineae, which start from papillary muscle and attach to the body of cuspis. What else? What else? Some words about left atrium. Left atrium receive blood from pulmonary veins. Do you know how many pulmonary veins in the human body? 2 from each lung. That is why general number is 4. 4 pulmonary veins inflow into left atrium. Heat is, they are absent. They remove when take this blood, this heart from human body. Heat is also absent. Heat is pulmonary trunk, heat is aorta, and heat is right and left atriums. Only some moments heat is. Next time I recommend you to receive preparates where we can see pulmonary veins, and I explain you in the beginning one again, pulmonary veins, okay? Last moment. Conductive system of the heart. Today I already said about SA node, sina atrial, nodus sina atrialis. Another node, atrioventricular node. This node, AV node, you're right, that this node take place in septum interatriale, between atriums, under the endocardium, near cuspis septalis of tricuspid valve, in this place. That is localization of AV node. And from this node start bundle of His, atrioventricular bundle, fasciculus atrioventricularis or bundle of His. And this bundle, it pass in septum between ventricles, it is septum interventriculare, and divides into 2 cruise of bundle of His, and they go to the apex and continue on the apex into Purkinje fibers. One again, repeat conductive system. First node, sina atrial, SA node. Second, AV, atrioventricular. From here start bundle of His. It divides into cruise or legs of bundle of His, and legs of bundle of His continue into Purkinje fibers. That is conductive system of the heart. It's produced and conduct nervous impulses, and it's regulate heartbeat. It's rate of heartbeat, regulate increase or decrease rate of heartbeat with the help of activity of this conductive system of the heart. Clear? That is why it is possible to remove heart from one person and transplantation of heart to another, and heart continue to contract. Why? Because it has its own conductive system where impulses, nervous impulses, start appear and spread to whole surface of the heart, and heart can contract without human body. Clear? That is important.
So in the case of failure of AC node, so we should put a pacemaker.